Very good evening to all of you, and thanks for joining Muscat Family Physicians and Hopetrust's CME program today. As all of you know, and I have already given you the mail, the topic of today is addiction. Now I would like to introduce to you with pleasure the first speaker from Hopetrust, Mr. Rahul Luther, who is also co-founder and executive trustee of the Hopetrust. He is a graduate in psychology, literature and philosophy from University of Delhi, and after putting in services of 25 years in the corporate, he started his social service, so-called. So he has about 15 years of experience in the addiction treatment, and he has established the first care and support facility for the people affected with HIV, AIDS, as well as the first rehabilitation center for addiction in the state. He is a certified addiction therapist from the Ministry of Welfare, Government of India. He is also a former director of international agency called MIBRI, focusing on HIV/AIDS and working in the rural areas of India. He publishes articles in leading publications, speaks on national radios and TV, and as well as lectures extensively on the subject of addiction. So may I request Mr. Rahul to start his presentation first, sir? Please, Mr. Rahul.
Thank you, Dr. Dharan. Dr. Rahul and friends, this presentation is about the treatment of addiction and how an integrated holistic approach is effective. I don't think I need to go through the initial slides, but as a formality I will, because there are so many doctors here. Basically, what is addiction? Addiction means that a person continues compulsively to use a substance despite having problems with it. And the first stage in addiction is dependence, and then when he begins to take more and more of that substance and tolerate the substance, it's called tolerance. Addiction is now recognized as a disease by leading medical authorities such as the World Health Organization and the American Medical Association. It's no longer viewed as a moral shortcoming. The DSM-5 definition of addiction means that at least any of the following 11 criteria, at least 3 of the 11 criteria, if it's fulfilled, that means there is an addiction. So if we say that addiction is a disease, that means it has definite characteristics. And the characteristics of addiction are primary, fatal, progressive, family disease, chronic, denial, relapse prone. I'll just briefly go through this. Primarily basically means that the problem is within the alcoholic or addict and not outside of it. He is not drinking or using drugs because of any other external reason. He is not taking drugs because his father has not bought him a car, or his wife is bad, or his boss is strict. It's a family disease means that it's not just the addict who is affected, but the entire family gets affected. It's a progressive disease, that means not only does the quantity and frequency of the intake increases over a period of time, but the damages caused by the addiction also increase over a period of time. It's chronic, that means it's incurable, though it is treatable. It is characterized by denial. Denial means that the person having the problem usually doesn't believe that he has a problem. He minimizes, rationalizes, justifies, blames, and it is highly relapse prone. And of course, if not treated, the person is likely to die, so it is fatal. There is also an associated disease addicts are called, in our terminology, they call it dependents. They are chemically dependent. So the family members are called co-dependents. The family suffers as much, if not more, than the addict, and they also exhibit symptoms just like an addict. They also obsessively, compulsively chase the addict. As the addict is chasing the alcohol or drugs, they begin to obsess about him and they run after him, they try to control him. They also go into some sort of a denial that no, for example, my son is a good boy, it's his friends who have spoiled him, maybe he needs a better car, maybe he needs a better job, maybe he needs to get married, he's lonely, so that's why he's... so they also go into a denial, and when the addict is using the drugs, they don't feel good. If he's not using the drug, they feel okay, so their well-being is dependent on the behavior of the addict. So this leads to what is called enabling behavior. They are constantly rescuing, protecting and supporting the addict, and therefore enabling him to continue with his addiction because they don't allow him to face the consequences of his behavior, and therefore he doesn't feel the need to change. One of the things that we do at our rehab is to educate the family about the enabling behavior, why it needs to stop so that the addict can get into recovery. The damages caused by addiction are basically 5. It affects the body. We know what all it can do to the body. It affects the mind, for example, memory, concentration, and most importantly, attitudes. The attitudes become negative. It affects the emotions because basically an addict begins to manage or control his emotions with the help of alcohol or drugs. If he's happy, he would like to take drugs. If he's sad, he'd like to take drugs. If he's angry, he'd like to take drugs. So with the result, the emotions are not processed and they are suppressed by the alcohol and drugs. The addict also begins to lose his sense of spirituality or his value or ethical system. He begins to lie, cheat, con, steal, manipulate. And lastly, his relationships get affected. Relationships with the family, with the friends, with colleagues, with seniors, with juniors. So any recovery means it has to have a holistic approach addressing all these areas. Because of denial, there's a lot of resistance towards treatment. According to one survey, 95.2% of the addicts do not feel the need for treatment. Therefore, at times, they have to be literally forced into treatment. Now, since addiction affects all areas of the addict's life, the treatment obviously has to be holistic, addressing the physical, mental, social, that means relationships, emotional and spiritual areas of his life. An addict's typical personality is self-centered, he's selfish, impatient, manipulative. So from this kind of a personality, to make him compassionate, he should have the ability to delay gratification, to accept reality as it is and not to manipulate it, and what Alcoholics Anonymous calls a profound personality change. There are obviously 2 options for treatment, the inpatient and the outpatient. Usually the outpatient works only for highly motivated addicts who accept, admit and recognize the fact that they have a problem. But usually that's not the case, and therefore inpatient is more recommended. Inpatient treatment also gives a break to the cycle of dependence, as we call it, because once he stops, he tends to have a craving which leads to a relapse. He begins to chase the drug again, and then again he stops. So this continuously goes on. So when a client is inpatient, this cycle is broken. Also, inpatient treatment allows for constant medical attention and supervision. Of course, during detox and withdrawal management it is important, but also allows for the clinical observation of the client in case he has any other issues, psychiatric or emotional issues. Also, an inpatient program allows the 24-hour access to any medical attention he may be needing, what is called post-acute withdrawal. He may have issues with any physical or mental issues. In an inpatient setting, he obviously has no access to alcohol and drugs, which is important in the initial stages so that he doesn't give in to his craving. Also gives an opportunity for the therapy team to provide intense counseling addressing all areas of his life, go deeply into issues, because in the initial stages there will be a lot of resistance, there will be a lot of manipulation, a lot of projection. The addict will say something else, will mean something else. So for that breakthrough to come from the side of the therapy team, they need to have continuous counseling sessions. Also, in a residential setting, the clients begin to develop and learn new coping mechanisms, develop new behavioral patterns, which helps in rebuilding their lives. An inpatient facility also protects him from the triggers of relapse. A trigger of relapse can be anything: a sound, a song, music, a smell, which can lead to a relapse. Also, based on the experience of the self-help groups like Narcotics Anonymous and Alcoholics Anonymous, it is found that if an addict is in the company of fellow addicts who can learn from him or he can identify with them, it helps in their recovery. And research and experience has shown that those addicts and alcoholics who start their recovery in a residential setting have a better chance at recovery. In a residential rehab, it's like a structured lifestyle. They sleep on time, they eat on time, and therefore, because during addiction, they have no structure. So that also helps in their recovery. So therefore, residential treatment helps in all these areas: physical recovery, mental, emotional, social, spiritual areas. This is again we are just explaining that the physical with the medical backup. We have, for example, yoga, mild exercises. Their irrational thinking or denial needs to be broken with interventions or with the family. We need to get a lot of background information, confront the addict with reality. At times they'll be very vulnerable or volatile in their emotional state, so they need the support of both the counselors and their group. Their damaged social relationships with family and the community also needs to be slowly built up. The addict needs to develop not religious but spiritual areas of recovery. He needs to develop qualities such as honesty, open-mindedness, humility, empathy, belief in a higher power. Usually an addict thinks that he's all-powerful. He's the center of the universe. This kind of a thinking is very prevalent with an addict. So slowly he begins to learn that there is a power greater than himself. It could be just the counselor who's interacting with him is a power greater than him. And slowly a belief in God or a higher power. We have a strong family support program which runs along with the treatment of the addict inside the rehab. This focuses on making the family understand that it's a family disease, that how it impacts them, how they need to recognize the fact that it has impacted them, and then they also need to be a part of the process of recovery. The various tools and family dynamics are addressed. Healthy balance is restored in the family. We also gather specific information regarding the family members so that it gives us a holistic picture of the dynamics of the family. For example, in the Hopetrust Family Support Program, we first educate the family that, for example, just to say that it is a disease, it sometimes is a surprise for them because they feel that maybe we went wrong somewhere in our upbringing, maybe he's in a bad company, that's why he's taking drugs. So once you tell them that it's a disease, then that stigma or that shame or guilt associated with the disease is removed to a large extent. We also tell them that in reality what addiction is, that it's a highly relapse-prone problem, so they need to cooperate. Relapse is quite possible, so they shouldn't have expectations beyond reality. We also introduce them to the family support groups such as Al-Anon. They have a presence in Muscat also, so that they also continue their recovery along with the addict. Then there will be some areas of conflict within, sometimes we get into marital counseling or other areas which need to be resolved to a certain extent. They participate in structured interventions, communication exercises. Then we evolve a relapse prevention plan based on the peculiar or specific relapse triggers of the client and how he needs to address them, so that they can also recognize the process of relapse when it is beginning to happen and take corrective steps. We also have regular classes for the family, educating them on various aspects of the disease. Aftercare and support is very important since it is a relapse-prone problem. Each client undergoes specific, personalized relapse prevention plan and a structured follow-up. They are asked to come back after a month or 2 months for a follow-up to address the challenges they are facing in ongoing recovery. Local Alcoholics Anonymous or any meetings, addresses are provided, and we also keep in touch with them. We sometimes contact our alumni and ask them to contact the addict who's just been discharged. So basically, treatment of addiction would be broadly these 3 steps. One is the detox, medical management of withdrawal, which you are all very familiar with. Post-detox, an important aspect is the holistic treatment, trying to bring about a change in his personality, in his attitudes, in his thinking, his behavior. And the third step would be to prevent relapse. I would say that sobriety is nothing but preventing a relapse throughout his life. Sobriety is nothing but preventing a relapse. The 6 elements of effective treatment in a rehab are: number 1, an individualized treatment plan, because nobody's history or background is same. So some issues would be common, but we need to tailor each individual client's treatment plan. This is another important aspect which Dr. Seshadri will talk about, that sometimes rehabs overlook the fact that a client may have an underlying or co-occurring psychiatric disorder which would make him very vulnerable to a relapse. That has to be simultaneously addressed, even by appropriate medication if required. A residential setting also gives the advantage to the client to be away from his normal triggers in his community, with his friends or his normal environment. Length of stay is very important. Research and experience has shown that minimum 90 days is required stay in a rehab. This is about a study in US that those who stayed for less than 90 days, 35% of them reported a relapse, versus 17% only who were there for 90 days or more. Empathy. That's why rehabs also employ recovering alcoholics and addicts as counselors or staff members. They understand the pain, they can identify, they've been there, and the client also feels that somebody who understands him is talking to him. He's had enough of uncles, parents, doctors, priests giving him lectures. But when another addict or alcoholic is talking to him, he feels that for the first time in his life, somebody who understands him is talking to him, so he responds in a positive manner. A strong aftercare program and support groups, Narcotics Anonymous and Alcoholics Anonymous, have proven to be very effective in preventing a relapse. I would close with that. Thank you.
I have spent about 2 months in France in a rehabilitation center for drug addicts, and I learned a lot from there. Knowing much about the French addict, make me know more about ourselves. In this way, I have to ask Dr. Luther about the spiritual program you are doing for such patients. I know that India has a huge spiritual background. I would like to know about how to use this background, spiritual or religious background, to help your patients in rehabilitation. Second question, also to Dr. Luther. You told us that you have to individualize the treatment program for your patients. Have you thought about making a drug addiction severity index for Indian population? Because as we know that not all addicts, as you have said, not all addicts are the same. The degree of severity of addiction differs between them. And this will help us to define how much, first of all, to define if there is a hope in treating such an addict or not. Number two, for how long he needs to be kept in hospital to achieve his rehabilitation program. This is the question concerning the drug addiction severity index. The need for a drug addiction severity.
Thank you, Dr. Difficult questions. I'll just try to keep it very simple. About first question about spirituality. We must differentiate between spirituality and religion. Religions could be specifically in different areas. Spirituality basically means that I get disconnected with myself, with the real self. I start having a bloated image of my power. My ethical and value system gets eroded. Spirituality means restoring myself to balance. That is the purpose of recovery from addiction. You mentioned India. Yes, India has a rich spiritual or religious background, but that's not relevant. Every country, every culture has a rich spiritual background. In fact, every family has a value system which is strong. And the person in recovery needs to connect first with himself and then connect with his family and community at large. And spirituality is an ongoing process which is a lifetime process. One continues to evolve. We may call it maturity. A person who is in his 20s and 30s would have a different attitude and different aspirations. A person who is in 40s or 50s would have different aspirations. So spirituality is an ongoing process. Recovery is an ongoing process, and in our experience, if the person is spiritually growing, he will not relapse. So his sobriety is contingent on his spiritual progress. Secondly, about the drug severity, my answer usually is very simple, that it's like being married. Either you are married or you are not married. So there is not half marriage or a quarter marriage. So if you're an addict or an alcoholic, you're either an alcoholic or an addict, or you're not an alcoholic and addict. Of course, you may be at an early stage or a later stage, but the treatment is the same. If addiction is arrested or intervention takes place at an earlier stage, then the chances of recovery are much better. A very interesting thing Dr. Amar said, that in my experience, the addicts every addict, even before his addiction, onset of addiction, feels that he is a little different from other people. Not only just different, but different in a superior sort of way. He is more intelligent, he is smarter, he can control things, and therefore that leads to behavioral problems and anti-establishment behavior, as you said. It's very true.
Thank you. A small token of appreciation from Hopetrust to Dr. Hammer.